Okay, so when we talk about fitness, we basically talk about lot of cardiovascular endurance, strength training, flexibility, speed. We talk about BMI, that is how much should be your fat mass or muscle mass. We also talk about flexibility, that is complete range of motion. But all these things will go in vain if your balance is not maintained. Because anytime you start doing a cardiovascular endurance exercise, that is simple basic exercise like swimming, like maybe jogging, or maybe running, or maybe dancing, or maybe doing Zumba, any exercise which actually increases your cardiac beat, that may lead to fall. If your balance is not maintained. So balance right at the center, and your line of gravity will change. Okay. So, or because they have better muscular strength, they have better posture, they have better maintenance of each muscle. It is not because just because it's not one set of exercises will ever help you. It has to be a mixed exercise protocol for any age group. Okay. And more as you age. So your exercise therapy has to be based on all the components, has to be individualized depending on the kind of body. For example, Padma ma'am can have a low back pain and she wants more of back strengthening exercises and lot of leg strengthening exercises, which may help her in better balance. Okay. But Chandrika ma'am has less of endurance, as in she gets very tired and lose her balance faster. So I need to work on her cardiovascular endurance and balance continuous. So for it, it will be always individualized when it is one-on-one patient consultation. But yes, when you are doing a group exercise program, which you may be taking, very important to have a mix approach. It cannot be every day just yoga, or it cannot be every day just strengthening, or it cannot be every day just Zumba. It has to be a mix exercises. Mix exercises also help you to improve your balance. So when I'm standing at the base of my support, if my line of gravity falls straight, my balance is supposed to be much better. Balance training is the ability to maintain your balance. Okay. That means whatever work I do, even if the place is not so, straight, and you feel that, Bangalore roads. Bangalore roads are full of pebbles and, like that. Even if those comes, you have the ability to balance yourself out even in those conditions. As we age, balance training becomes more important. Why? Because it helps you to prevent falls, and because falls can lead to a lot of fractures and injury, which may take a lot of time to heal. So you lose your time, you lose your independence. Okay. So to maintain that independence, you need to have balance. In addition, it can help you to continue to enjoy the things. For example, only because a person of 74 years old has strength and balance, they are able to run. I have seen so many runners who are 72, 74, right? That's because they have good balance, good posture, good muscular strength. Okay. The overall goal of balance training will be always one. See, I cannot say, ma'am, why are you not balancing yourself? You can't balance yourself. Your muscle strength is less. So I need to figure out which muscle strength is less, and I need to improve that muscle strength. As the muscle strength increase, your balance will automatically improve. Okay, now I am having imbalance because I have Parkinsonism, or I have any neural disorder. In that case, if I continue doing the muscle strengthening and not focus on brain nerve coordination, then your balance will not improve. So I need to work on a lot of coordination exercises to improve your balance. Okay, so for neuro cases, it will be different exercise. For musculoskeletal cases, it will be different exercise, because musculoskeletal cases, you need to improve the strength. Neural cases, you need to form the nerve and brain connection. Okay, vertigo cases, for example, a lot of people have vertigo. Okay, vertigo means their ear, the fluid is, so lot of exercises which are basically based on neck, and you do those neck exercises and your balance starts becoming better. So that's why for each condition, if the imbalance is due to certain condition, then we need to figure out what is the condition, because your exercise protocol will definitely differ for all the three. Okay, balance is very challenging, but once you attain, there is so much of freedom which you experience. Okay, so all of us will always include balance training in our exercise protocol. Now, why an exercise program is necessary for balance training? Because at all times, at any age, we need to work on our body constantly. And as we age, it is definitely a myth that we should slow down. It's completely, in today's era, age is definitely a number, because you will see a 70-year-old woman who is basically a yoga therapist, and you will see a 18-year-old boy who is struggling to sit down. Okay, because they are all brought up in English toilet, they don't know how to squat, and they have such tight muscles. Okay, so it is actually become, yes, degeneration happens, which we cannot deny. Yes, genetic role play a very, very important role in your body. But if you work towards your body constantly, ramping up your workout, again, it's a myth that at your age you should not put dumbbells. You should put dumbbells. You should have ankle weights, because that only will improve your strength. You need not do 10 kg of dumbbells. You can do 1 kg, 2 kg, 3 kg, but you have to do dumbbells, or you have to do some weights, resistance. So improve. The best anti-aging cream in this world, I always say, is your strength training. The more stronger, the more muscular you are, the more anti, वो बोलते हैं ना, आंटी आपकी एज की, तो वो है, there's a gone song, no, आंटी जी get up and dance. तो वो करना है, तो you have to have lot of strength training in your protocol. Okay, so you should always ramp up your workout, as in you should not maintain your workout. Your workout should go like this. You start like this, and then you become very comfortable, then go little more. There are chances that you may have some disease, disorder, imbalance, some injury, that your fitness goes down. But because fitness is never like this, fitness is always like this. I always say fitness is always like this. You go up and suddenly one day fever aa jata hai, 3 दिन बिस्तर पे पड़े रहते हो, and then again you're back to pavilion. So, but you have to always go back and come back, go back and come back. Okay, so it's very important to ramp your workout, because as you ramp your workout, your physical activity will improve, your flexibility improve, and lot of risk which is there, which are related to various health condition, that reduces, because you're constantly trying to be as active version of yourself as possible. So being mobile, being strong, being steady. Okay, this is the 3 mantras which stays with you. Mobile, strong, steady. On your feet can help you independent, to be independent. Once you are independent, what happens? Your confidence just boosts up. You're like, no need, I will do it by myself. No, I'm going for a holiday. Yes, nobody can. I'm going on a solo trip. That's because you know that your body is mobile, your body is strong, your body is steady. Okay, so that confidence will only come with a proper exercise program. Okay, along with you, so few conditions which can worsen your balance. Okay, which are associated with imbalance, right? So one is arthritis. Knee arthritis is such a common condition. And lot of people, you have to understand that knee replacement is not bad. Once there is no gap between the two bones, you just cannot create the gap. And for movement, you require the gap. The more gap it is, the more movement. The no gap, no movement. And every time you try to do movement, the bones are actually rubbing against each other. So if you think you are 62, 72 and you require a good knee replacement, and all the doctors have told you it's okay, get the knee replaced, do good 6 months of physiotherapy, and you'll be back to mobile. Okay, so don't restrict yourself. Don't say that okay, अब तो 70 के हो गए, अब क्या करना, अब जो भी होगा देखा जाएगा, because you don't know how many years you're going to live. If you're going to live for the next 15 years, do you want to stay immobile? No. So always, but if you have not chronic arthritis, but just the arthritis has developed, then try to maintain your muscle mass, especially hamstring and quadriceps and hip muscles, so that your muscles mass takes lot of load away from the bone and less weight is going to the bone, and then you will not have so much of pain. And when you don't have pain, you will have better balance. You don't have pain, you will have better balance. You have pain, you will be more imbalanced, because as you put the step down, pain, and then you get imbalance. Okay. Second condition, which I already told, is migraine and vertigo. Every time there is a huge, it's you'll be like, this side is all gone. You'll get up and you'll feel all dizzy and you'll again sleep back. Okay. So if it is migraine, then you need to know that what migraine is a symptom. You need to know why the migraine is coming. Are you allergic, say, to sun rays? Lot of people says, as I see the sun, I feel migraine. Or you are allergic to certain kind of food which is giving migraine, or it is basically the hormonal changes, the menopausal changes, which is causing you the migraine. So you should know why the migraine is coming. Migraine is just a symptom, so that you can treat it. Vertigo has lot of exercises associated with it, which can improve vertigo as well as your balance. Plus, if there is an acute attack of vertigo, then of course the doctor tells you to start taking Vertin, which will reduce your symptoms. Okay. Cardiovascular and neurological diseases like stroke or Parkinsonism, okay, that will also cause lot of imbalance. Now, stroke rehabilitation is completely different than Parkinsonism rehabilitation. Parkinsonism is more about coordination exercises, because there's lot of the nerve and brain just disconnects. Okay, because syndopa. So syndopa they give because dopamine is the neurotransmitter. So here the dopamine get restricted. Either the path is restricted or the dopamine is less in your body, and the brain and neuro junction just don't coordinate with each other. So you need lot of coordination exercises to build up the balance. But in case of stroke, everything is gone. Like the whole neuromuscular disconnect has happened. So first is form the connect. Form the connect as in you form where little movement comes, and from movement you go for a bigger movement, and from bigger movement you start achieving milestone. Like if the patient was lying down, whether the patient is now sitting, whether the patient has started standing. Once they start standing, then you start working on their gait and balance. Okay, so it's a very long journey with stroke, depending on the kind of stroke they have. There are different kind of stroke. Vision impairment, of course, you get cataract or any things like that, your balance will get affected, because this is your biggest biofeedback. You see surface and you change the way you are walking. You're seeing a stair, you will walk like that. You are seeing a plain surface, you will walk. You are going on a trek, you will walk like that. So if vision impairment is there, of course your balance get affected. And some of the medication, how many of us have said, after the cough syrup, I feel lot of dizziness, right? So many of the medications also make you feel sleepy, drowsy, imbalanced. Okay, when we categorize balance, we categorize it into two parts, that is static balance and dynamic balance. Static balance is the ability to maintain the balance in some fixed posture. So all the yoga posture, yet what you do and maintain them, that is your static balance. So standing on one leg, standing on an irregular surface but standing straight, or standing with eyes closed, all that is basically static balance. Now when how to improve your static balance can be improved by maintaining the posture. So if you feel that when I tilt to one side, then I feel imbalanced, okay, then you can try doing little bit of trikonasana and try to maintain it for 10 seconds, then go to other asana, trikonasana, and try to maintain this. Will improve your side static balance. Okay, but what is dynamic balance? Dynamic balance, it is the ability to have postural stability and orientation while you are moving. So when, for example, when you are running, or when you are dancing, or when you are trying to be dynamic, then, or when you are walking very fast and suddenly you lose your balance, okay, that is your dynamic balance. Now how to make your dynamic balance better? Dynamic balance becomes better depending on, I need to study your gait is the way you walk. So I need to study the walk, and I need to figure out what is going wrong, that why are you losing imbalance, is there a muscle strength which is reducing, right? So if I build up that muscle, your dynamic balance will be much better. You're losing your gluteus, you're losing your hamstring, you're losing your quadriceps, your dynamic balance will not be so good. Okay, so I need to figure out what is getting wrong. Now what are the safety and quick tips we should follow? Okay, one is, you should always, I say this in any age group, you should always listen to your body. Your trainer or your fitness instructor or your physio will always push you, because that's their work. They need to push you beyond your boundaries. But if you feel this is too much, you need to listen to your body and tell your instructor, no, this much only, right now I can only challenge myself this much. And okay, so it is very important to say no or not to do certain things. If your body, I always when my patient asks me that what exercises I should do, I said your body will tell you what exercises you should do and what you should not do. Okay, so your body is the best indicator. Start slow and steady. Always remember. Okay, here we want to be tortoise. We don't, if we come first in the race, very good. Not come first in the race, we are not in any race. We want to be slow and steady and maintain the balance and have common sense and listen to our body. Okay, whenever you are exhausted, you have soreness in your body, you have painful muscles, you are overdoing it, just stop there. You say, okay, this much, that's it, khatam. Okay, because over exercising at your age is very dangerous, and under exercising at your age is even more dangerous. Okay, so that balancing in your body will also come when you listen to your body, because nobody has, I always say that no two patients, no two individuals are same. Okay, and because I have lived in this body forever, I understand this body like no doctor, like no physio, like nobody. Okay, so you listen and you say no, you say stop, you say go, you decide. Okay, when to stop, when to go, when to take a break, when you can go ahead, all that and your body will definitely indicate you. For example, small pains, small aches, don't avoid. Go and see why the pain is happening and do something about it. Okay, over exercising, no. Under exercising, no. If you have a problem with imbalance, then make sure that if you are exercising, try to keep a table, a chair from which you can take a support, which is not unsteady, which should not have wheels down. Okay, so it should be very steady chair or table, which can help you attain this balance. Okay, if you feel that what you're doing is not okay, then go to a physio, go to your doctor, go to your fitness instructor, and talk things out. Don't do it just on your own. Okay, and very important is, if you are doing a dynamic activity, very important to wear shoes. Okay, so if you're, for example, if you're doing jogging, then you have to wear jogging shoes. You just can't wear any shoes. Wear jogging shoes or wear running shoes specific to that activity, because that is designed to maintain your balance better. Okay, and always remember that your shoes should not be too tight or too loose. It has to be very, very appropriate. Okay, that means if you're size 5, you can definitely wear a shoe of 5.5. Or especially if you are thinking of doing a dynamic activity, in that little half size bigger actually is much more comfortable. Okay, and always wear clothing which you are very comfortable with. For example, I always say that if you are planning to do a lot of hip exercises or knee exercises, don't wear sari. Okay, because there are many women who wear sari and then they feel very uncomfortable or they lose their balance while doing the exercises. So whatever you are comfortable with, please use that. Okay. Now, how to maintain a good balance? Okay, one is you start doing with non-dominant leg. For example, your right leg, if you use more, then your right leg balance will be always better than the left leg. So you start with the left leg, or start all the exercises with the left side first, and then do it on the right side. Okay. Second is, while doing your exercises, try to look yourself in the mirror and see whether you are maintaining a good posture while doing it or not, because you have all the capacity to get into a wrong posture because the body is degenerating. So your maintaining posture is very, very important if you want to maintain the balance. You should always focus the gaze. Always in yoga, they will say, look in front, try to focus at one single thing, especially if you are standing on one leg, tree pose, like that. They will tell you, focus on one gaze, because as you focus like this, you will feel unstable. So focus, okay, on a one fix, whatever, maybe one light or maybe one bottle, whatever you are seeing right in front. So focus there. Okay, try doing in different position. For example, initially you are standing very steady, then you try doing it with eyes closed near to a almirah or wall where you just can't fall and all that, and see whether you can balance with eyes closed. If you can, then you can lift your one leg and see whether you can balance with one leg, and then one leg with eyes closed. So, and everything should be near the wall or near the chair where you can hold on to whenever you feel the imbalance. Okay, and whenever you have these exercises in which you have to bend your knees, then you should be more precaution oriented, because you don't want the whole weight to go on to your knee. So never your knee should cross your toes. So when you are bending the knee and toes should be at one line. Don't cross it beyond that. Okay, always know that you should be distributing the weight evenly on both the sides, right side and left side. Many of us have the habit of sitting like this. What will happen? My more weight is going on the left side, right side is not having. Similarly, when we stand on one leg, we're not standing on the other leg. So very important is that you distribute the weight evenly between both the foot. And if you get tired, you can always shift your weight, but try to distribute as much as possible. Your balance will improve if you If you, once your static balance is okay, then you try dynamic balance, as in taking the ball from here to there, or taking it from above to below, or taking it from left to right, right to left. So when you change the direction, or when you close the eyes, or when you gaze at different positions, your dynamic balance will improve. These are some of the exercises which you can think of, like how she is standing on the toes, or they are moving their hip on all the direction, front, back, side, you can move, or getting up from the chair, sitting back in the chair. Initially you can take the support of the chair, then you should leave the support and you should get up on your own, like that. I will show you now the video. The video is around 15 minutes. And then just
Physiotips, Arogya Physiotips में आपका बहुत बहुत स्वागत है. So today's topic is going to be balance exercises for the elderly population. So as you know, when we are young and we have an active lifestyle, the thought of balance problems doesn't actually cross our mind. But as we start to age, that is when we realize that slowly our balance is becoming problematic. This can happen due to a variety of reasons. The most common reason being muscle weakness. So as you're aging, your muscle strength and power reduces. So the ability to maintain balance, you start to lose it slowly. The second cause being arthritis and joint problems, which causes pain and in turn hampers your balance. The third reason could be a long-standing illness such as heart diseases, hypertension, where if your BP falls suddenly, then you might get dizzy and you might have a fall. Other reasons could be vision problems and hearing problems as you get old, which also affect your balance. As we slowly start to lose our balance, the chances of fall increases. So as we age, another problem is osteoporosis. So osteoporosis is a condition in which your bone mass decreases. So your bones get weak, so the chances of falling increase, and if you fall, the chances of fractures also increase. So it is very important to incorporate balance training in your general day-to-day exercises. It will help in improving your muscle strength, your coordination, and also your general posture. It will improve your confidence when you walk and will decrease the chances of falling. Let's move on to the exercises now, but before that, please like, share, and subscribe to our channel, Arogya Physiotherapy. First exercise is head rotations. You can do this if you have some vision and hearing problems, because the movement of the head is what causes dizziness in such cases. So you have to accommodate your body to sudden head movement. So you just start with clockwise direction of head rotation. You do it around 10 times in one direction and then 10 times in the opposite direction. So start slowly, then you can increase the speed and eventually you can progress to closing your eyes and trying to do the same. If you feel dizzy, take a break for a few seconds and then try again. Next exercise is sit to stand. So for this, in the beginning stages, you can take support with both your hands. If you have an armrest, you can use the armrest. Okay? Press down on both your hands, come forward at the waist, and then slowly come up. Okay? In the initial stages, you can maintain a bigger gap between your feet so that there is more stability. But once you're comfortable with this, slowly decrease the gap. Eventually, you can just take support with one hand. And when you are good at this, you can try crossing your hands across your chest, bending forward, and then get it. Make sure that when you sit down, the back of your legs are in contact with the chair so that you have more confidence and you don't flop down. Okay? So control your descent. Okay? Touch the back of your legs to the chair and then slowly sit. Next exercise is marching. So for this, you keep some distance between your feet, hold on to the chair with both your hands and start marching. Okay, in the initial stages, you can take lower steps, but once you're comfortable with this, you can take higher steps. Your knee and hip can come in the same line. Okay? The progression of this could be that you could take only one hand support and then eventually just one finger so that you can maintain the balance. If you're trying to do these exercises without any support, make sure you're doing it under supervision. Please do not try these alone. The next exercise is standing hip abduction. With this also you have to take support with both your hands and you're supposed to move your hip away from your body. Make sure you do not bend at the back. Your hip remains stable. Then you just move outwards. Okay? So in the first phase, you can take support with both your hands. Okay, you can do it 10 times on one side and then 10 times on the other side. Eventually, one hand support, and the last thing being one finger for balance. Exercise is standing hip extensions. So the position is the same. Maintain some distance between your feet, and then you have to take your leg backwards at the hip. Try not to arch your back. Your back is straight. Just your leg goes back. Okay. You can do it 10 times on one side, 10 times on the other side, starting with double hand support and single hand support, and then just your leg. Next exercise is single leg balance. So here you need two chairs for support. So hold on to both the chairs and one leg, bend it and lift it up. You have to try and maintain this position for around 15 seconds. In the beginning, even if you can do it for 5 seconds, that is okay. So 15 seconds is your aim. Okay? So when you're comfortable doing it holding both hands, then you can shift to just holding one chair. Okay? And then again, just use your fingers for support. Please do this under supervision because we do not want to fall. Next exercise is weight shifting. So this can be done in two ways, front and back and side to side. So front and back, you keep one foot in front of the other, hold on to the chair to shift all your weight to the right side while you lift your heel up for the left foot. When you come back, lift your toes up for the right foot. Okay, so start slowly. You can progress by increasing the speed and eventually go into one hand support. Okay? Then you can alternate the legs and do it the same. Aim on doing it 10 times for each side. Side to side weight shifting. Okay? Hip width distance between your feet. Okay? All the way to the right side. Slightly lift the left foot off the ground and then the other side. Okay? Initial stages, you can use both chairs for support and then just hold on to one chair and then no support. Okay, but please do this under supervision. Exercise is tandem standing, also known as the heel to toe standing position. So the toes of one foot are in contact with the heel of the other. So one foot in front of the other. You just have to try and balance in this position. So you can hold both chairs once you're comfortable, just one, and then eventually balancing without any support. Once you're comfortable with this in a few days, you can practice by holding the chair and closing your eyes while still trying to maintain this position. Next one is tandem walking. For this, make sure you have a wall or a table next to you for support. The same position as tandem standing, but here you have to try and walk in a straight line, keeping one foot in front of the other. Make sure you have a wall next to you, which you can hold while you walk. Next is the clock reach exercise. So in this, in the beginning stages, you can start with a narrow base of support, your feet together. You have to imagine a clock around you, this being 12 o'clock, this being 3 o'clock, this being 6 o'clock. You just have to reach out in that direction. Okay? Do it on the right side, do it on the left side. If this is difficult, you start with a wider base of support, eventually go to a narrower base of support. Hand is the same, you can take one hand support and eventually take no support at all. Next one is known as the alternating vision walk. Here you have to walk 5 steps normally, but when you walk, you have to look to one of your sides. Okay? So starting with the right, you look to your right and you walk 4-5 steps. Okay, same way, go back, then you look to your left and then you walk 4-5 steps. Make sure you have a wall or a table to support you at all times. Next exercise is side stepping. So initially you can start with keeping a wider base of support. You take a step and then maintain that 1 foot distance between both your feet. This is how you can start. You can have a table in front of you or a kitchen slab in front of you which you can hold and you can walk on. And then you can progress by having a narrow base of support. So keeping both your feet together. And also progress by taking slightly larger steps. Larger step, narrow base of support. Larger step, feet together. Next is a figure of 8 walking. For this you need two objects, maybe water bottles, which you keep at some distance. And then you start, you have to walk between the two objects. Okay, it's like making an 8. Okay, so start with taking longer steps. Okay, you have to go around the way. Both times, when you go front and you come back, you have to go around the objects. You can do this around 10 times. There are chances that you might feel dizzy. That happens, please take a break and have some water. and then try again. If by any chance you feel very dizzy or there's a lot of instability, please take a break and then try to continue the exercises. If the problem still persists, please stop doing the exercises. If you suffer from hypotension or if you are on some medications which cause dizziness, please speak to your general physician before performing any of these exercises. If you like our content and want us to keep making more videos, please like, share and subscribe to our channel. Witness your fitness with us.
So that was around 14 to 15 exercises which can help you improve your balance, and demonstrated in the video so that I don't have to see which angle I should be in. So when you are doing a balance training, always remember, one, you need to work on your gait, the way you walk. If you see that there is something which is not happening proper, whether the weight is not distributing proper, you are using right leg more than the left leg, something like that, then you need to work on that. Second, you need to work on your balance and coordination. Whether so when for example, when your leg is walking, whether your hand is also coordinating along to improve your balance or not. Okay, or if you are if you feel that it is musculoskeletal problem, then you can work on your strength. That itself will improve your balance and coordination. And keep your you can also keep your exercise like functional task. Functional task is what you do in your activities of daily living, what you require to do every day. I require to be balancing in the stairs at least 20-25 stairs. Then your exercise protocol will revolve around stairs. That means go 2 stairs up, come 2 stairs down, then go 3 stairs up, can come 3 stairs down, something like that. And improving your quadriceps and hamstring strength. Okay, also strengthening exercise of both upper limb and lower limb need to be there. But evidence for the effective computerized program, there are a lot of computerized program these days. You can, you know, you're looking at there, and they will tell, you know, it will move, and you will also try to balance like this or like this, like that. Or there is a vibration plate which happens down, and they tell you to stand and tell you to balance in that. All that is also very effective, but there is not many research paper which is done for it. So we need to still be very confident about it. How you can improve your balance on everyday basis? You can multitask activity. I have told you your exercise has to be different multitask. You can't be doing one thing. One thing will improve your balance in that one particular activity. So multitask yourself. Do a mixed workout, do tai chi, do yoga, do that I told you, no, virtual reality, like something will play here and you have to move it along. That also improve your balance. Core strengthening, lower limb strengthening, upper limb strengthening, that. Then there is something called balance board, like wobble board, in which you stand and try to balance yourself, and it keeps going from right side to left side or front to back, and that is available in any of the sports shops. Okay, make sure when you are doing the strengthening, you are doing it with resistance band or TheraBand, loop band, dumbbells, ankle weights, all these things, because you really require to build up your strength. Okay, more because of this age. Okay, so don't think that only these simple exercises you should restrict to. If you are comfortable, you can always go to advanced exercises like squats, half squat, full squat, lunges, just shifting, as I told you, just shifting of ball from side to side, or two people workout where you give the ball to somebody and then take the ball from here and then give it here, and then that also improve your balance a lot. So don't restrict yourself from one particular activity. That's what I meant. Every time you improve in any activity, advance yourself, advance in your strength. Okay. So exercise for better balance, or your world may turn upside down. See, if I've written the thank you ulta, क्योंकि अगर balance गया तो you will see it like that. Okay. I hope you enjoyed the presentation, and I am open for question answer, so you can always.
Yeah, so you said balance will really depend on the problem of a particular individual. So whether it's skeletal or muscular or neuro or whatever. How does one figure that out? Can one come to you for a individual one-on-one consultation, find out what is the problem, and then start from there?
Yes, yes, yes. If it is, see, musculoskeletal, how you will figure out is when you start walking little bit, your joints will start paining, or you dizziness, pain related symptoms you don't feel. You will feel more of a muscle pain or cramping or more of a general weakness. That is generally
Generally.
musculoskeletal. Neural will be always associated with some neural symptoms, like, as I said, dizziness, coordination issue. And of course, if it is a neural issue, they generally figure out because they will go to a see, if you've got stroke, you will know. If you've got Alzheimer's, you've got, Parkinsonism, most of them get diagnosed in early stages because of the advancement of medicine now. So generally, the symptoms are very basic in musculoskeletal and very brain oriented. Like you will say that when it is vision or ear, it will be direction shifting. So as you direction shift, you feel dizzy, or when you shift here, you feel dizzy. That is more to do with your vision and ear, especially vertigo kind of problems. So there is a generalized division where you can, but yes, on one, we can obviously see you better.
Okay,
You well
thank you.
answered. Huh.
Is there any remedy for the this thing sarcopenia where elders keep losing the muscle mass? Can it be restored or it should be maintained? And what is the way of
It can be
doing?
maintained. It
Very
can't be
dangerous.
completely restored. It can be maintained if we completely keep working on the muscle. It can be maintained, but not completely restored because your condition itself is about losing muscle mass. Okay, so if you don't exercise in this condition, then definitely it is a problem. Okay, so but yes, you can maintain with progression. Like I always say, workout has to be gradually going up. So when you keep on making progression, your sarcopenia will be much
But I
better.
have seen because I've seen elders, no, they start, they keep falling frequently and leading to a lot of other consequences.
But how many of them work on one with physiotherapy? See, when you have a condition, for example, stroke, the physiotherapist will come to your house for 1.5, 2 years, right or wrong, right? And you will see the improvement. Then you will see a stroke patient who has just done 3 months of physiotherapy, and then they say that it did not progress after that. There is a very huge difference when you work one with a physio or with somebody who has medical knowledge, because they can progress you. This is a condition which is going to remain till you are at the deathbed. So you have to be completely in touch. That's the whole concept of geriatric physiotherapy. Geriatric physiotherapy is not about just solving one small issue. Geriatric
Correct.
physiotherapy is making the age as much as possible rehabilitated and make them mobile till they are there. So there was this lady, I Vasanta auntie, and she was 72-year-old, bilateral arthritis, a dialysis patient, bedridden, and I was actually treating her daughter, and she had lot of interest that I should treat, and I don't take home cases and all. So she used to bring Vasanta auntie, and Vasanta auntie would refuse to work out with me at all. She will blankly say that I will not do anything. I don't know why my daughter is doing all this. I am supposed to die now. It is my time to go die and all that stuff she will tell. And then after 15, 20 days, she's like, this lady will not give up. So she started cooperating. She started doing exercise with me. And she died doing plank. She did she was just doing everything. She became mobile. She sat down. She had not sit down for almost 12, 13 years. She sat down, she used to do yoga. She exercised with me for the next 4 years, every single day. Every single day she has come to me. But see the progress from bedridden. She always told me that I have seen too much of hospital. I don't want to die in hospital. She didn't die in hospital. She died at her home peacefully. So that's the beauty of doing exercise with somebody who is a medically equipped person, so that they can always increase the workout pace and can listen to your body at the same time.
Very true. Very encouraging. Thank you.
Pooja, I have a question. Is it okay to start your, muscle building exercises when you are around 63, 64, which you have not done earlier at all?
Very, very, very okay. Very okay. I mean, if
Strength training.
the day you start, जिस दिन जागे उस दिन सवेरा. I completely believe on that proverb when it comes to exercise. So any day you exercise, it is only going to help you. You will start slow and steady and gradual and slowly progress. So yes, even if
Especially
you're not
weight training.
all your life, you can do it.
No, especially weight training.
Yes, you can start with half kg dumbbell, 1 kg dumbbell, 1 kg water bottle, everybody would have taken, or just the rice or half kg atta, everybody would have lifted, right? So it's not that you have never been exposed to half kg or 1 kg. So start with half kg or 1 kg.
What's the best surface to walk on?
Every surface is best surface to walk on.
No, because
depending on your balance.
we have this concrete surface, cobblestones, and each one has its own drawbacks. That's what I find. And
yes, I know. But the thing is, see, of course, the muddy surface is the best surface to walk on.
yeah,
Because one, it is never so smooth, so there'll be slightly irregularity, but because it is muddy, it is a soft surface, so you keep seeing. So you train yourself for balance also in the muddy surface. But in Bangalore, if you are, then half of the time after April or May, it will be raining, and it is very difficult to walk on muddy surface from April
I
to.
know that.
So then in that case, you are left with the road surface only or a solid surface only. But treadmill is something which I definitely say no. I don't like. I'm not a fan of treadmill at all. Maybe because I'm
not
an
good.
outdoor person, but I will always tell my patient, no treadmill, please. I don't know. I don't like treadmill so much. I feel it is so hard on your knees.
Yeah, it's bad for the knees, I think.
In treadmill, what happens? You walk also on a constant speed. That is not the case when you are walking on a surface, because you change your speed according to the kind of surface you're walking, or if you're taking a turn, or if there is a bump, you change your speed. But that does not happen in treadmill. That is the biggest disadvantage. So constantly there is a constant pressure on the treadmill. So apart from treadmill, I feel everything has advantages and disadvantages. Best will be soft surface, but I don't know how many months you can get that soft surface, especially in Bangalore.
I
One
heard
more
it's
question.
good to walk without footwear on, different surfaces like grass and,
Only
sand.
grass and sand.
Okay.
Grass and sand,
Not
because
on hard flooring.
lot of biofeedback which goes. Lot of biofeedback, and grass also, the morning grass, which is basically with little bit of usko kya bolte hain, oats
Dew.
Yeah, dew, with the dew. So that is very good because there's a biofeedback going on. Lot of nerve endings in your foot.
So
it-
not good to walk on hard surfaces barefoot.
So that's why it is very important to wear the shoes. That's the point I was emphasizing, that when you're going for walking, and especially walking in a surface, then wear the proper shoes for it. Don't wear just any slip-on. That is not good.
Yeah.
If we don't have any more questions, we'll let you go, as it's 6:30 already. And thank you everyone for attending.